So what kind of, KPIs or key performance indicators or key success factors, like what do you consider those? There might be a lot of those, so we might just have to go with a couple or three, but because you might have a list, you might have a long list.
We have quite a few, but I'll give you a couple examples. So we talk about our consumers, the patients. We're trying to create a suite of consumer engagement tools that makes it easy for them to do business with us. Okay, and it's when I say easy to do business with them, it's meet them where they want, when they want, how they want. Okay, so if they want to do completely electronic or virtual and they want it on demand now, we want to meet them now. If they're okay scheduling an appointment over the phone for a week from now, we need to do that. So we basically have to meet them where they want. So we do lots of surveys, but one of the key ones that we're looking at right now is basically called the Net Promoter Score. The Net Promoter Score is how likely are you to recommend to anyone, a friend or a family member, the Christ Hospital Health Network.
And if you don't get a 9 or a 10, it doesn't count.
That's right. Would you recommend or wouldn't you recommend? And what that does is it takes all these things that we're doing and it wraps them into how easy it is, and not just how easy is it to do business with it, but your experience from how you engage to get the appointment scheduled, to your experience with the clinician, to how you paid your bill and dealt with the insurance, all that whole experience. How did you like that? Would you recommend it to someone? So that's a big one for us. I think the employee productivity, we have lots of measures on normal operations, just the speed at which we do things. They're typical operational metrics from the number of hours we spend on various things, to how fast we do, to how long it takes someone to get scheduled, to the throughput and so on. So we have just a lot of, I would say, just operational metrics for internal operations. And then on the clinical side, again, it gets back to kind of the productivity of a nurse or a physician, primarily like a physician, in terms of how much time is he or she getting to spend with patients, because that's what the patient wants. So we're trying to eliminate.
That's kind of where the rubber meets the road, isn't it?
Exactly. That turns into better perception, better healthcare, better outcomes. So we already know that we're ranked very high on clinical care. Okay, so we are ranked very high. Our physicians and nursing staff and so on, all those that perform those procedures, the patients feel we do a great job. What we need to do is wrap enough around that to create that enough time and the experience and the speed at which they get their service to where they're happy about it. So part of that is making the clinicians productive to where they can spend the appropriate amount of time. So, and we have measurements of that. It's not really the number of, you always measure the number of patients like a physician sees, but again, it's the amount of time they're spending in the computer doing non-clinical work, or the amount of time they're spending at home that's a drag on them and their efficiency. Those are the things that matter. It's not just how many patients we can push through the system. It's really how much time they can spend with patients.
Yeah. So the next question I was going to ask is, where do you see the business value coming from? But I kind of feel like you've already answered that. I kind of feel like your last response actually kind of squarely nailed that.
It's kind of, if you think of what's the goals and the critical success factor, they are kind of like wrapped together. We're trying to differentiate ourselves for the consumer experience. We're trying to improve our outcomes and try and improve the productivity and the cost structure so we can do a good financial perspective for the patient. I think those all kind of get wrapped together.
So as we wrap up here, I have one more question, and I think it's kind of an easy one because you're not where you want to be. I know you talked about any new ERP system, and you probably have some others, but what's left? What's left on your digital transformation roadmap?
We have just started our ERP project. It's going to go on for the next year. So that has been funded and started. And a lot of people look at ERP as a back office, but for us, we do consider it transformational because the tools that we'll be implementing will have significant improvements in workflow, the analytics, some of the reporting, access to data in a way that our users never had before. So even though it's kind of a back office system, we do consider it will be transformational to how we run our business. So we have that. We're in the process of redoing a significant portion of the hospital in terms of how we manage alerts and alarms. When a patient needs some sort of help, that alarm could be generated from a lot of different systems or even the patient themselves. That alarm has to go to someone. It could be to a physician or a nurse. And today, there's a lot of what we call alarm fatigue because there's not a lot of intelligence in there. It blasts out these, hey, someone needs help, someone needs help. So we are in the process of transforming to where we're putting a lot of intelligence to know who's this patient, what do they need, who does it need to go to, and kind of orchestrate that response in a much more efficient way, which will create a lot less stress on the clinical staff. That's a big one for us. We need to move into basically this is more in the back office, RPA with maybe some artificial intelligence. When we get into things like insurance claims, collections, there's a lot of opportunity for efficiencies in the back office like that. We want to expand our telehealth. We talked about doing video visits, but there's a lot more we can do in that space, whether that's remote monitoring of patients in their home to doing virtual second opinions for cardiology. There's a lot of telehealth options that we see expanding. I don't know whether we'll get into some of the hospitals are doing things like, smart rooms in the hospital. This gets into where the patient control the temperature, the lighting, the curtains, the TV. We're kind of looking at that. There are actually some financial benefits to doing that. It's not just the aesthetics of doing that, but something we'll take a look at. And then we've done some experimenting with IoT, putting some more intelligent device tracking, whether we know where our inventory of IV pumps are, and we can locate them quickly to, wheelchairs, to even some temperature monitoring in pharmacy and those types of things. So I do believe that there's a space. We've done a little proof of concepts, but I think that's in our future as well. That's a small sampling. We have a few more. That's a pretty good
I'm
sampling.
sure that the list is long. I know we're in the technology space, so it seems like it's never ending. There are more projects than you can possibly get to.
Yeah.
But I want to say thank you, Paul. Appreciate you joining me today. And thank you to all of our listeners. Please visit comspark.tech. That's COMSPARK.TECH for additional interviews. And we'll say goodbye until next time and have a great day. Paul, I appreciate your transparency and your digital transformation journey. Thanks so much.
And thank you, David. I appreciate it.